Dr. Gottlieb, former FDA commissioner, Pfizer board member, and contributor to CNBC, who is featured in the documentary, is still here with us. How big are these drugs likely to be? And they're not only finding that they're effective against weight gain or bringing on weight loss, but a whole host of other conditions, potentially even including dementia.
Yeah, look, I think these are going to be a profound medical advance on par with maybe the introduction of statins, where you're going to change the trajectory of morbidity and mortality associated with a whole range of diseases. And we think about this as a battle of what is the best drug. It's going to become a battle of what is the best label, which drug ends up getting the best label for trying to prove some of these secondary gains. This is going to be a very important year for answering that question. We saw the SELECT data that Novo Nordisk ran a big trial looking at a substantial reduction in cardiovascular risk with patients who had a previous heart attack or stroke. FDA and the EMA, the European regulators, are now looking at that data. They're probably going to approve a change to the label of Wegovy to demonstrate cardiovascular risk reduction. And Lilly's also going to have important data with their drug Zepbound this year, looking at, for example, reduction in the incidence of sleep apnea or heart failure associated with the use of their drug. Collectively, between Lilly and Novo, they have more than 15 trials underway that are sort of registration quality trials, looking at things like, reducing the incidence of osteoarthritis, of fatty liver disease, of dementia. If we continue to show these secondary benefits of the weight reduction that these drugs achieve and get that information into the label, I think it's going to make these drugs very compelling and very hard for insurers not to pay for if you're having that magnitude of public health impact.
That was going to be my question. Is this going to make them harder for insurers not to cover, number one, and ultimately will it bring down the cost?
Well, I think it's going to make it impossible for insurers not to pay for it. If you have a drug where you have a cohort of patients who have significant cardiovascular disease, have had a stroke or a heart attack, and you can achieve a 20% reduction in the second stroke or heart attack, and these are patients who have been maximally treated with statins and hypertension medication, that's such a profound benefit. And the benefit was seen early in that trial as well. So you didn't need to leave the patients on the drug for a year. You saw it within the first months. That's so profound, and that's going to achieve so much savings for the healthcare system overall. That I think
they'll leap in.
Right. And also the productivity gains. As people lose a profound amount of weight who are obese, they're going to perform better at work. They're going to have less joint disease, less osteoarthritis.
Fewer days missed from illness or debility or whatever.
And that data will start to get into the drug labels. The other thing that's going to happen over the course of 2024 and 2025 is both Lilly and Novo and other companies as well have other drugs in development. So Novo has a drug that's a dual-acting agonist, acts on both DACA and GLP-1, CagriSema. They're going to have data in 2025. Lilly has a drug, retatrutide, which is a so-called triple agonist. And these look like better sort of second and third generation iterations on these drugs. So, we're in the early innings of the innovation in this space.